name is Dr. Tony Falvello, and I'm seeing patients at the Coordinated Health Campus in the Churchill Mall in Hazleton. I treat a multitude of conditions. I'll see everything from back and neck pain to arthritis-related pain of the hip and knee, and also foot and ankle disorders in sports medicine. I got interested in medicine early on in probably high school and junior high when I was playing a lot of sports, and I went to the local hospital in Hazleton to watch an orthopedic surgeon perform surgery, and since that time I've been on the path of orthopedic surgery and been committed to that and knowing that's what I wanted to do. In my younger days, I was participating in sports quite frequently. I played football, I played baseball. Basketball was our big sport and was the big sport back then, so that was what I committed myself to. That year, we had a great year. We went 29-2, lost our first game and our last game, which unfortunately was the state championship, but I was able to be a member of the team for the first year of the Hazleton Area High School, which really brought the community together. You know, in my family we have about 4 or 5 attorneys. We've been providing professional services to the Hazleton area for many years. When I got interested in medicine, I chose to study orthopedic surgery and always knew I wanted to come back home and provide those services to the people in Hazleton. I went to the Philadelphia College of Osteopathic Medicine for a number of reasons. A lot of the doctors in Hazleton had graduated from there, and I sought out their advice when I was applying there, and a lot of the physicians from Hazleton gave me support that I never could be where I am today without that. When we got out of the bookwork after the first 2 years, I got into the rotations, got into the hands-on medicine and the procedures, and I loved it. And I loved surgery, I loved being in the OR, and you know, everybody who becomes a surgeon, you gotta be willing to work late and work hard, and I didn't mind that at all because I loved what I was doing. After medical school, I was looking for an orthopedic surgery residency, and again I went to a place where a lot of physicians from Hazleton had gone, Community General Osteopathic Hospital in Harrisburg. That was part of the new Pinnacle Health system. We got the great general orthopedic training at Pinnacle Health. We got to do trauma at Hershey Medical Center, where we had, you know, Lifeline helicopters bringing us trauma all the time, and that was a wonderful experience. I had a great mentor there, mentors I should say, and I did pediatric training at Children's Healthcare of Atlanta, which was the #5 children's hospital for pediatric orthopedics, and there we got to be involved with procedures that, you know, we are really at the cutting edge of medicine in pediatric orthopedics. When you walk into the door to the Coordinated Health Campus, you're going to see a number of things. In the back we have our physician offices, and we have imaging and other departments there that provide services that a lot of patients need as relates to orthopedics. In the front we have physical therapy and other services. Also they have a great service there called Care on Demand, which is for an urgent care setting, injuries, work-related injuries, things that don't need the ER but still need to be seen. General orthopedic needs are the primary focus of our care. And the most common orthopedic conditions: arthritis, rotator cuff injuries, also trauma. We do a significant amount of trauma. The general orthopedic need in Hazleton is so great, and it's so underserved. There's no reason that people should have to go out of town to get their orthopedic care. We can do it right here in Hazleton, and raise the bar for the standard of care as well. We can see you for the simple issues, we can handle those. You know, if you've got something complicated, we can deal with some of those, or get you to the right place where those things can be taken care of. I live in the Sugarloaf Valley, and I live with my wife Isabella and our son Wilson. We have a dog, Pippin. He's a big part of our family and accompanies me on many hikings and hiking excursions and hunting. And we spend our free time primarily doing things outdoors. I haven't been hunting and fishing that long. Actually, he's a good friend of mine in med school who got me into that. We used to drive up from Philadelphia after our rotations were over, and we'd go out, sneak a few hours of hunting in or a few hours of fishing, and do whatever we could, and then drive back down to Philadelphia later that night. Growing up in Hazleton, I did get to know a lot of the physicians, and Hazleton is a small enough town that you know the big names, and when it comes to physicians in town, medicine nowadays is a team approach. It's not just me, and it's not just their family doctor. That communication between me and the other doctors in Hazleton is so crucial to providing great care. And there are so many great physicians in Hazleton that provide excellent care, and I'm just trying to continue that tradition. As an orthopedic surgeon, there's many options available to my patients as to where they have their surgery. I will continue to serve the community through Hazleton General Hospital and also through the Surgery Center. we'll be able to have patients from Hazelton have their surgeries in specialty hospitals like is available at Coordinated Health for many routine orthopedic procedures, joint replacement, outpatient surgery, and those things that typically you had to have done at a major center. Now you have the option of having them done at a specialty center such as Coordinated Health. I've treated numerous patients with injuries, not just from local high school teams and junior high teams, and also kids with sports injuries, but also the weekend warriors who may injure themselves on a weekend in a game of basketball or something like that. I've been treating many work-related injuries in Hazelton. There is a lot of industry in Hazelton, and there's a lot of need for work-related injuries. The vast amount of work-related injury in orthopedics in the area is really staggering, and there's such a high demand for that type of care. That's a very rewarding part of my job because these people are usually injured, and they're coming in because they need to get back to work, and to be able to help them do that is very rewarding. Coming out of residency, I had other opportunities to do things such as fellowship or go to other cities and do more training or even practice in other cities. I always knew I wanted to come home, obviously because of family and my family's commitment there. So coming back to Hazelton is something I felt I had to do, and in fact I knew 2 years before I graduated residency that was my plan. And the biggest reason for that is the quality of people there. I mean, there's good people in this town, and it's just a great place to live without the high stress lifestyle that you find in the city. So there's a lot of rewarding things to being an orthopedic surgeon. Perhaps one of the best things is when you see somebody come walking into your office and they've had a hip or knee replacement, and they were nervous about it before, and they say, I don't know if I want to go through with this, but they come in, and usually it's a couple months later, but they come in and they say thank you so much. And that's one of the most rewarding things. And in orthopedics, we seldom have a chance to intervene and save lives and save limbs, and we do that, and those people are always thank you, and that's a rewarding part of my job. But also it's the people who come into your office and say, I need help, and I want to be able to do these things that I couldn't do before, and you say, I can help you, and you get them there, and that is by far the most rewarding part of my job.